What are the best natural anti-inflammatories and pain relievers? Patients ask me this all the time. Well, the most proven natural anti-inflammatories and pain relievers are some natural agents like curcumin, which comes from the spice turmeric, as well as white willow bark extract, ginger, and boswellia. Now, how do they work? They work very much the same way that aspirin and ibuprofen work. They block the conversion of certain fats into what are called prostaglandin hormones. There are some very inflammatory hormones that tissues make called prostaglandins. And when you block their synthesis, then you reduce inflammation. And that's how aspirin and ibuprofen work. They block those enzymes which are known as cyclooxygenase and lipoxygenase. I know they're big words, but there are natural compounds that can do the same thing. When you use aspirin and ibuprofen and indomethacin and Voltaren, which is diclofenac, these, although they're anti-inflammatories that block the inflammatory prostaglandins, they have side effects. They have side effects like causing erosion to the intestinal tract, which can lead to ulcerations and internal bleeding. That's not uncommon. They've been shown to cause liver damage and kidney damage. They can lead to heart failure, cardiovascular deaths, high blood pressure. And I'm not overstating this. Long-term use of these anti-inflammatory drugs have been known to have side effects like this, and it's becoming a major concern across the healthcare community. Drugs like acetaminophen actually are strongly related to liver failure and kidney failure if they're used over a long enough period of time, just at the normal dosages. So the idea is, it's not that those drugs don't belong, they do. But you want to try to lower your reliance on them or reduce your reliance on those kinds of synthetic anti-inflammatories and pain relievers, including narcotic drugs like things that contain codeine and Percodan, Percocet, and stronger ones like Oxycontin. So when it comes to natural anti-inflammatories, it's important that if you're going to use these natural herbal and accessory nutrients I'm talking about that are much less toxic, that you use the right dosage. So what are the right dosages of these things? For curcumin, what you want is a supplement that contains turmeric that's a 95% standardized grade of curcumin. And you're going to need about 600 to 1200 milligrams per dosage to really get the anti-inflammatory effect over the course of the day. With boswellia, it needs to be a standardized grade of 70% boswellic acids. And you're going to need, again, about 600 to 1200 milligrams over the course of the day to really get an anti-inflammatory effect. With white willow bark extract, it needs to be a standardized grade of 15% salicin or salicylic acid. And you'll need about 100 to 200 milligrams a day from that source. And with ginger, even though eating ginger is great, to get an anti-inflammatory effect, it has to be a standardized grade of 5% gingerols, and you're going to need 150 to 300 milligrams a day to make that happen. Now, I actually like to get a supplement where all those things are combined into sort of one capsule. You might take, say, 3 to 6 capsules a day to get the curcumin, the boswellia, the white willow bark extract, and the ginger all in one. Together they can block the cyclooxygenase and the lipoxygenase enzymes that lead to inflammation. So you're sort of getting a nice natural anti-inflammatory effect. Are there other anti-inflammatories? Yes. The flavonoid quercetin works very well. Bromelain enzymes also work very well. And so those anti-inflammatories are really good for certain conditions like tendinitis, bursitis, when you have a muscle strain or a muscle inflammatory problem. Even for spinal disc herniations, they can reduce the inflammation significantly. They helped me personally at one point. For lower back strains, for whiplash injuries, they can be used in place of anti-inflammatory drugs to decrease your reliance on how much of the anti-inflammatory drugs you're going to need. Why am I bringing this to your attention? Because many family doctors and rheumatologists and orthopedic surgeons fail to mention to patients the importance of diet and exercise and supplements in the management of these cases. It's very unfortunate, it's very disappointing, because these natural things can make a really big difference for you. And you can decrease your reliance on these prescription drugs, which can lead to some significant side effects and toxicity, and sometimes even dependency. So the best thing that you can do to understand all of this is to download the ebook that I have called Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. It's available right here, so you should do that right now. The booklet shows the exact lifestyle plan to help you better manage any inflammatory or arthritic condition, and can be used along with any medical treatments that you're undergoing presently. So every arthritic patient in particular should have a copy of this ebook, Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. So download it right now. Now, machinohealth.com, you'll see my other review articles, videos, footage from my live seminars, resources, other downloads I've created that are available to you to help you lead a long, healthy, functional life. My review articles and my research materials contain all the scientific references to make sure you're seeing only sound scientific information on anything that you're searching out. So be sure to make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much.